Welcome to the live stream, everybody. Very nice to be here with all of you. My name is Mahesh Narayanaswamy. I'm a classical Hatha Yoga teacher from Satguru Gurukulam. I did my training in 2022. And we're here today as part of the Hatha Yoga Wave. This wave is a collaboration of about 38 teachers from North and South America. So we're getting together to teach a Hatha Yoga practice, a set of practices, on the same day all across the Americas region. So we're excited to do this and come together. And as part of this, we wanted to have this conversation with Dr. Claudia. Um, and we're going to really focus on the intersection of yoga, classical yoga, and the medical science. We're really excited to have Dr. Claudia Matos-Miranda here with us, and she will introduce herself, but she's a medical doctor and a Hatha Yoga teacher. So the team at Hatha Yoga Wave is very excited to put this on and also to hear a different perspective about classical yoga and how it relates to the medical community. So, Claudia, excited to have you on, and if you want to just introduce yourself, go ahead.
Thank you so much, Mahesh. Hello, everybody. This is a very nice initiative that that means that we're all coming together and make it happen all at once. Yes, my name is Claudia Matos-Miranda. I'm a medical doctor. I am also a geneticist. I do integrative medicine and also do genetic counseling. In fact, when I'm doing integrative medicine, I do cover some aspects of genetics every time I see somebody. But yes, as Mahesh says, I'm also a Hatha Yoga teacher, a classical Hatha Yoga teacher trained to offer the practices that were designed by Sadhguru. And I've been giving classes since 2013, and I can easily say that I've been giving classes every day because I do give yoga sessions to all my patients. So all of my patients, they do receive some yoga practice at the end of the meeting that they have with me. So yeah, we will today talk about how yoga relates to medicine, how yoga can be considered an epigenetic intervention, which is super relevant nowadays. And that is the main reason why nowadays people and all the medical community, it is considering yoga as a complementary and an integrative practice to offer to any kind of patient or to any kind of person who is going through some kind of health issues, and also for the people who do not have. And we will go through that now, why it can be such a wonderful tool to help people get better if they have a disease, and also how we can actually help people prevent developing something if they are practicing yoga.
Thanks, Claudia. Yeah, so to kick us off, there's a word that maybe many of us have heard thrown around, and I've also heard the word epigenetics, and wanted to maybe explore this topic and this word and what it relates to, what it is, why is it important. I think a lot of us have heard about genetics, and this word is fairly, I'd say, maybe new, maybe not in the medical community. But if you can share some light on this topic, and we'll kind of go deeper into this epigenetics.
Yes. Well, to talk about epigenetics, we also need to talk about genetics because epigenetics is part of genetics as a topic. Epi means over, on top. Okay, so this is kind of what is over genetics. And all we know that genetics is related to inheritance, right? It's like we all know that we get some genes from our parents, and these genes that we are receiving from our parents, we receive them from our grandparents. So we either have the nose of one of our grandparents anyways, right? That's inevitable. So it means that we are receiving information from them that makes us up. What give us the genetics is kind of if they gave us a little seed of something, Nowadays, it's easy for us to say that if, let's say, my grandmother had diabetes and my mother had diabetes, I can suspect that I may be having diabetes, right? It means that I inherited, at least I inherited the predisposition to have something, correct? Then that is normal that we already know at this point. That's why now we talk about, oh, but my mom had this, my dad had this. Could it be that I have it? So that's genetics. It's receiving a seed. It means receiving certain genes that would actually create certain proteins that, I'm going to make it very simple, will mean that you will have some disease. So we actually inherit predisposition. In other words, we inherit vulnerability. Okay? But epigenetics is what is on top of it. It seems that in the past, when we were studying genetics, we thought that when we had all the map of the genes, we will be able to control everything and then we will be able to know everything and so on. But it happens that no, because it's not only that I receive the copy of my mom or my dad and I will be destined to have that condition or that structure. Actually, there is something that happens on top. It means anything that makes those genes that I received to be off or on. So it means that the expression of a gene. So what the expression of a gene is what happens that you see, right? The expression of the gene can be stopped or it can be activated. So in fact, we realize that we have many more genes than whatever we can be expressing. So it's obvious that some of those genes were being silenced, right? And some of those genes were being expressed. And epigenetics makes that. It creates that, it turns on or off the button of expressing a gene. And why is so relevant? Because it means that, yes, okay, I receive a seed, but if I didn't put water, and if I didn't put any kind of a special soil for it to grow, it won't happen. And that's the marvelous thing of it. And all of us, we are a combination of those two things. For example, and that was very relevant when we were seeing this. In the past, we were thinking many, many, many years ago, we could imagine that two people who had the same DNA structure, like for example, identical twins, right? I know you're an identical twin. Okay. So obviously, if we see you next to your brother, we will see probably two people who look pretty much the same. But you are not the same, right? Because you probably did fall from, playing and he didn't, or he did eat certain food and you didn't. And those little events that were different were actually having an effect on your genes. And they were telling your genes, turn on or turn off. And that's the reason why two twins that can be exposed to two different environments, okay, can have such differences. You will see, oh, but he was supposed to have this disease because his father has it. Yes, one has it and the other doesn't. And it's because one probably has been doing something that was silencing the expression of that condition. There was a very interesting study in McGill. I actually was trained in McGill University in Canada. And in this university, they did a study. I'm just going to be I'm going to tell you the story very simply, okay? They put two groups of rats. All the rats, the two groups of rats, were the result of a clone. So every rat was technically a copy of the other one. And these rats were supposed to express genes that would create a tumor. But they divided the group in two. Into one group, they put them with a rat that was a mother. And they put the other group, they put them alone without the mother. They noticed, and what did they observe? That in the group that did not have a mother with them, 100% of them, did express the gene that was giving them a tumor. But the group who had a mother with them, so it means that the mother was licking them, was giving them warmth, was, creating a certain environment. That group, only about 30% of the rats who were destined to have a tumor had the tumor. About 70% of them didn't have it. That is epigenetics. It means that I receive a genetic, but whatever happens around me would have an impact on how I will be developing and how I will be expressing those genes. And why is so relevant? It means that your genetics does not, determine your destiny. Actually, when they were publishing this research that I'm talking about to you, they actually publish it with a title saying like, are your genes, are your genes saying what is your destiny? And the answer was like, not if your mom has anything to do about it.
Yeah.
So it is the reality. That means that maybe we cannot change our genes because we cannot change our DNA structure, but we can change how they express. And
Mhm.
it is known at this point, over the last 10 years, there has been vast research that shows that yoga does create a certain impact on the body, that it is considered right now an epigenetic intervention because it makes a certain quantity of inflammation go down. One of the most important epigenetic factors that we have is stress. It's the food, it's what we drink, what we eat, what we inhale, and the level of stress that we are being exposed to.
I want you to keep going on this. But yeah, like when I hear the word yoga, a lot of times it's, I know we've done our training, so we know a little bit of different contexts. A lot of times we hear yoga as a fitness or with stretching or for certain health benefits. But I mean, even this is a new thing for me to understand in terms of this. Can you continue what you're saying and see how like classical yoga or even yoga can go into this deeper element of influencing these genes and maybe how that works or what you've experienced with that. That would be great to explore.
So, to make something very complex easy, um, to be able to turn on or off these genes, you need to do some kind of changes at the level of the nucleus. It means that you need to create a certain environment in the nucleus of the cell, okay, to have access to these changes that will turn on or off the genes. And apparently, I mean, I'm not going to go through the different mechanisms because they are very complex. But many of those mechanisms are actually right now, we already know many of them. And we know, for example, there is one mechanism that makes or silence certain genes that would actually create Alzheimer, for example. We already know at this point that in Alzheimer, we have observed certain epigenetic changes that relate directly or seem to be relating directly to the development of Alzheimer.
Hmm.
And apparently, these changes that we see at the level of the cell are related specifically to how much sleep we had during our life. At this point, we already know that people who have Alzheimer, they have a history of not sleeping well. So it
Hmm.
seems that sleeping well avoids, the silencing or the turning on of certain genes that can actually help develop Alzheimer. So what happens with yoga? When we do yoga, we already know at this point that it helps the sleep deeper,
Hmm.
longer, and better, right? And when I mean longer, I don't mean in hours. It means in
Hmm.
terms of, okay, I get easier into deep sleep and then I can recover myself easier. Then in that case, we are not allowing the epigenetic changes that would create these kind of neurological conditions. Then in that sense, for example, yoga helps tremendously, right? Because it will decrease the difficulty to fall asleep. Yoga
Mm.
in general is, we can easily call it a science right now. Why? Because we can put it to test and it will give us the results. It's not something that we're just saying and it happens because it's placebo. No, we know at this point that whatever we give as a yoga practice will have an actual effect. And those effects have been studied. And we know that yoga has been designed 1,000 years ago. That's why it's so fascinating. It comes from traditional Indian medicine, right? And it's very fascinating because when they created these practices, they actually created them knowing how each one of them will affect certain parts of our body. That's what we know that it affects, like, okay, we know it's going to be helping us to have a better endocrine, um, you know, uh, function, right?
Mm.
So
Yeah.
when we do that, why? We are, and I'm going to explain in a very simple way, whatever we think is going to have an effect on our endocrine system. Why? Because we do have in the middle of our brain, we have something that is half nervous system, half endocrine system. Endocrine system is that system that makes the hormones release.
Mm.
So whatever we think can have an effect on the way how our hormones are liberated. And how our hormones are liberated have an effect on our immunological system.
Okay. Mm.
And how our immunological system it's working, obviously our health is going to be. Yoga has that effect. It works directly on that axis, on the mind body system. And apparently, when they did create it, when they did design these practices, they knew what they were doing. And that's why it's so fascinating, especially when you do classical hatha yoga. You know you're going to the source of that group of practices. And that's why they are so effective. That's why you will see stories of people who they started doing yoga, and because the inflammation went down, right? Then you are having an epigenetic intervention, and then you're changing the story of your body. If you're having a disease, then it may help you to decrease the severity of the disease. Let's say you have diabetes and you're doing yoga. Diabetes is highly related to high levels of inflammation. Then, if I drop down the inflammation, it will help you to get better. So, that's what nowadays in medicine we consider yoga a great complementary tool because, okay, we need to give you medication because you need it. But if I give you yoga as well, then I may be able to even remove the medication before I was thinking I have to remove it because it accelerates the process of getting better. It helps you, it synergizes. In some cases, you can remove the medication, but maybe you can drop, the
Right.
quantity of medication that you're using because of that reason. So sometimes people were thinking in the past, oh, you know what, this seems to be some false advertisement. No, yoga in general will decrease anxiety, will decrease inflammation factors. So for sure, it will help you. To which extent, that's a different story, right? We
Yeah.
cannot offer that, eventually is going to cure all your diseases, but it will definitely help you decrease the severity and make the disease easier to take also because when we are sick, we also get anxious. If yoga helps you decrease anxiety, you're already doing yourself a favor.
Yeah. And I think we can both speak personal stories of classes where we've had, examples of participants coming with something and they've definitely had, even in a 3 or 4 day workshop, they'll have improvement and sometimes very noticeable improvements in their symptoms. So that's great. I did want to mention for the group, those of you in the live stream, feel free to put your questions on the chat. We'll have some time, maybe 10 minutes at the end, where we can take some of your questions. And so while we're talking about certain topics, we do want you to encourage you to type your question in the chat. and we'll definitely look at, if not everything, definitely a handful of questions. But yeah, Claudia, I wanted to look at this a little higher level. You've gotten a chance to be in enough, different hospital systems. You're now in South America, and there's this word of, you touched on it, complementary medicine or maybe holistic medicine. Some of it's vague. Some of us know bits of it. Can you talk a little bit about what you see as like the trends going forward in how medical care is, evolving? We would love to see that yoga becomes a tool, but I think some of us think that maybe it's far away, right? And it's not around the corner, but maybe you also have some insights as to some of these trends. So it'd be great to hear your perspective, maybe even ideal perspective or just what's happening, whatever you can share with us.
Yeah, okay, I want to talk about what it is complementary medicine, and also I will take the mic to talk about integrative medicine.
Mm,
Complementary medicine, in other words, it's as the word says, complementary. I mean, it's complementing, okay?
mm,
So it's all those different tools that we can use to complement the treatment of modern medicine. And the majority of the complementary medicine tools are actually coming from what we call traditional or ancient or indigenous medicine. Okay. Everybody in the world, everywhere where we are, we have a system that belongs to that land that was used to treat medical conditions or problems that we had. It's been for thousands of years like that. If you think about it, modern medicine is called modern because it's not that old. Okay, so we also call it allopathic medicine, and that's the most prominent in politically speaking, and also it's the one that they teach us in schools of medicine, right?
sure.
That's allopathic or modern medicine. But complementary medicine is all those tools that come, in the majority of the cases, from ancient medicine that has been gone through an evaluation and has proven to be safe and efficient.
Okay.
So safe and efficient that also modern medicine can use it. Because the basis of modern medicine is something that we call evidence, right? We need to make sure that we're not talking about placebo effect, that we're talking about real efficiency, that it is really working, that it is safe as well. So there's a group of practices that come from ancient medicine or traditional medicine for which we have proven that they are safe and they work. They actually do what they say they are doing. Okay. And in that case, we can use it and accompany the treatment of modern medicine. It means if I have diabetes, again, I keep on with the example. If I have diabetes, we have a treatment of some medication, but at the same time, I can accompany it with yoga,
Okay.
right?
Got
So
it.
that's complementary medicine. What is integrative medicine? Integrative medicine means that instead of just using as a complement, because a complement, after all, it is optional. If you go and buy something, they will tell you, do you want a complement to it? Do you want a complimentary tea with your piece of bread? And you say, no,
Right.
no, thank you, that's okay. Or no, it's integrative medicine doesn't give you the choice. Integrative medicine tells you, I'm going to give you medication, but I'm going to give you some kind of complementary tool because I have the security that this is working. And in the case of integrative medicine, we use the best complementary tool. It means the one that actually works. And in that sense, yoga, it is considered one of the best practices from ancient medicine that can be easily integrated in the treatment of certain conditions,
Okay.
right? So that is for when we're talking about somebody that is having a certain condition. So it actually helps a lot. And you were asking how soon it is, how soon are we going to see people using it? We are seeing it. It's just that there's not much knowledge about it. But the WHO, I didn't mention that, but I am past director of the WHO Collaborating Center for the Americas. So we actually talk about this for traditional complementary integrative medicine. The WHO has one unit that talks about it. And actually in India, there is the Center of Traditional Complementary and Integrative Medicine for the WHO.
Mm.
Why? Because obviously, yoga is one of those big tools that we want to implement, not only in India, not only in Peru, where I am, it's around the world, and it is happening already. So, more and more medical doctors will learn about this. It's true that some medical doctors do not know about this yet, but there is a whole movement
Okay.
that is talking about this aspect, so many more medical doctors know the power of yoga as a complementary and integrative tool, and more people who offer yoga will be called to give these practices.
Sure.
So it is already happening in the US. The NIH has I invite you to see it. They have something that is called the Complementary and Integrative Health Center. And this center has a lot of information about how integrative medical doctors we work. And yoga is one of the big things that they promote. So it's not going to happen. It is happening already. But it's true that, as anything, it starts growing slowly and then it will go more and more. There is now integrative medicine departments in the biggest hospitals in the US. Hopkins
Mm.
has one, Mount Sinai has one, UCLA has one, Arizona State University, the hospitals that are associated with it, they have one. Um, many big Ivy League university hospitals are having now integrative medicine departments. And in these departments, yoga is one of the practices that they do offer as part of it. Also, now we are seeing that, as much as the body is being affected positively by yoga, we know that the mental
Mm.
health is also positively affected by yoga, because again, the inflammation goes down, and when we are too tired, there is a stress and we need to sleep better. At this point, there is already some interventions that are happening, not only with patients, there is interventions that are happening with medical doctors. So
Okay.
nowadays,
Yeah.
there is an interest to give these practices to medical doctors to decrease the um, possibility of developing burnout, because
Mm.
again, I said at the beginning, we can use this as a tool to help people get better if they're already sick, but we can also use these tools to help people to be okay and prevent them from, having these epigenetic changes that can create disease. We actually want the epigenetic changes that can make us healthier and be well.
Yeah. Great. Yeah, that's excellent. Do you think that medical schools will eventually start to incorporate these kind of even yoga? I know there's aspects because obviously you need to have research and it's yoga is a subjective science, so we have to make sure we, how to say, have a structure so that they have a set way of teaching and not something that's a little bit vague.
Yeah.
But yeah, do you think that that's a possibility maybe with some of these large institutions getting interested?
Absolutely. I
Yeah.
mean, of course,
Yeah.
we know because we belong to kind of the same, I mean, we belong to the same group of teachers, but Harvard has been doing some research on yoga,
Yeah.
and they have been doing research on the yoga we do provide, um, because there are many different schools and different types.
Yeah.
In my opinion, the yoga we offer is a great tool to not only help people get better or prevent the development of diseases,
Hmm.
but also it helps us to create a certain homogeneity in the results, because we all teachers, no matter where we are, We can be in Dubai, we can be in India, we can be in Peru, we can be in Colombia, we can be in the US. We all give the same practices the same way.
Yes. Yeah.
So the tool is very strong because of that reason. For example, I do follow some people, from as, giving them medical counseling. I follow them that they are in Korea or they are even in India or they are in the US. And I say, okay, your teacher that is located in Ohio,
Yeah.
it's better that they give you this kind of practice. And it works because it
Right.
doesn't matter if I give it or like somebody else gives it. That's why it is so strong because it helps us to create a certain homogeneity, which is very good when it comes to research. But
Right.
if medical school
Great.
will start giving it, yes, it started happening. Me, I've been training different places. I got some training in Hopkins in Baltimore, had training in Boston, in Tufts in Boston, in McGill in Canada, here
Mm.
in Peru.
Mm.
And obviously I talk about these things. I mean, also in Europe, I had some training in Oxford. So we talk with all my different friends around the world because I was very blessed to be able to go to these places. And they are telling me that more and more is happening. And nowadays, for example, me, I've been working over the last 10 years to create a certain normative so governments can actually accept that medical doctors do um, prescribe yoga as part of the treatment.
Okay.
We are
Mm.
discussing about this with the WHO to see to which extent this can be even bigger. I know they are doing many more things than what I did, but it is happening. And also, in my experience here in the university where I work, because I'm a professor here at two universities, in one of them, I do teach the medical doctors about this.
Mm.
It is a course that talks about this. And we will be teaching to the medical students, like not only to doctors that are already graduated, but we will be talking to medical students since the very first years about this possibility. I've heard that in Toronto there is also an interest in this, and I was in the World Congress of Integrative Medicine that happened recently in Brazil, where I was giving a little presentation. And in this place, the quantity of people that were there, the US, it's expanding at the level of education. So
Mm.
you will see more and more. It's true that it's starting, but I can easily
Yeah.
in the next 10 days, this growing tremendously.
Very nice. I think, yeah, before we get to the chat questions, one final question. On the March 21st for the Hatha Yoga Wave, we're offering the practices of Angamardana standing practice and breathing pranayama called Nadi Shuddhi and meditation guided by Satguru. So Claudia, maybe you can, from your perspective, share how these practices specifically on this wave on March 21st, maybe who would benefit or something about these practices from a health perspective and what people can expect if they register for that class and if they're interested but they're not sure that maybe what they can expect or get out of the class. So we'll finish with
Great
this question
question.
and go to the chat. Yeah, but go ahead, Claudia.
Yeah. Yeah. So the practices that we will be offering on the 21st of March are very good in general for the majority of people that want to have some kind of practice that can be established, in a daily basis or even, 4 times a week that would allow them to have a certain cardio, the stimulation. Okay,
Mm-hmm.
so if you're looking for to have something that keeps you strong, your body, your organs, and also your legs, okay, it's
Yeah.
very good. I would say to people, I know that maybe when they get into the class, they will see, oh, wow, this is a very, I would say, physical demanding practice, but don't worry about it. Everybody can do it. Okay. No matter how small, big, experience you are. We chose a practice that would allow people to have some kind of physical training But then we will be doing pranayama. And in this practice, this is a different level of practice. This practice will actually help us reduce the way how the rhythm of our breathing, which actually help us decrease anxiety. So if you suffer out of anxiety, this practice is for you.
Yeah.
Right? So if you suffer from anxiety, if you suffer from depression, for sure, this practice is great. And then at the end, we will be doing a meditation session. So I think everybody will actually appreciate it. People who cannot do the practice, it's mainly people who have some kind of recent injury in the back, but an injury for which your medical doctor have told you you cannot bend. Okay,
Okay.
if
Mm.
you just have, let's say, scoliosis, or you have a history of hernia, it's okay, you can do it. Okay, I'm talking more really about who cannot do it, people who had a recent injury in the back and the doctor has told them you cannot bend over.
Okay.
Otherwise, everybody's invited. Don't worry about it. Even if you have more weight than the one you want to have, it's okay. You can come. Okay.
Great.
And people who is pregnant cannot come to this class. We make sure that eventually maybe we will do some kind of a hatha yoga way for pregnant women. Okay. And
Great.
people who had an open surgery that has been done less than 6 months, or a laparoscopic surgery that has been done less than 6 months ago, 6 weeks ago, sorry. So if you had an open surgery and 6 months hasn't passed, you cannot come. If you had a laparoscopic surgery and 6 weeks hasn't passed, you cannot come. Otherwise, you're free to come.
Great.
Anyways, you can always write to us, visit our page, and you can talk to us and to the local teacher, and we are all together. And obviously, we will be there for you to answer the questions if you have any doubts. And if by any chance you see that you are not in the group of people who can come, remember that we are in your town, so we can offer you other practices also. So
Mm.
just because you cannot come to the Hatha Yoga Wave, it doesn't mean that you cannot come to our class. So we invite you all to look into our initiative and know that we are all over America. We're in North America, in South America, and we're giving classes in English, in Spanish, and in French. So that really is a great opportunity.
Great, Claudia. Thank you so much. Yeah, let's move to the chat if we can have some different
Yeah.
topics and continue the conversation. Maybe I'll let uh, you take a look and I'll
Okay, let
also
me
try to
see.
peek over.
Yeah, I have
Um,
some questions. I think
okay.
we have,
Yeah.
I have some questions here. So,
Yeah.
okay, let me see.
If you want to
Okay.
just take your time and read through and pick whatever you
Uh,
want to go with. Yeah.
yes, okay. Here. Okay, there is a question here. So, Namaskaram, Claudia. Have you seen any cases where autoimmune diseases have been completely cured, such as Hashimoto, ever? Is reversal of autoimmune ever possible? If so, if for example, series of infections can turn on genes to activate autoimmune, can those genes be turned off? Very good question. In general, what we have seen, yoga has an effect directly to the immunological response axis, okay, directly. And we have seen that people with autoimmune disease get much better, uh, even when we measure their immunological, when we measure how they are immunologically speaking, they get better. But I don't know of anybody who has completely reversed. I've seen people who do not show any signs of the disease. I know, and I have treated people like that. Um, for example, it does help in the case of Hashimoto itself. Hashimoto is a disease that when it happens, it will be there like any autoimmune disease. So what I can say is that what we have seen is that it decreases the severity of the disease, but it does not erase it. We haven't seen reversal per se, but it does create a condition that people actually go around as if they don't have anything. I had many experiences. I remember in 2014, I'm talking about more than 10 years ago. I did see somebody that had this, this condition where they cannot actually even walk. And after we were starting doing practices of yoga, they started walking. And that happened in Montreal when I was giving classes there. It was very emotional. Once we were giving this class, they were doing the practice daily. And before, this person had to be held by her partner to take her to the room, to the yoga room. And one day she actually called me and she said, "I'm outside. Do you mind opening the door?" And I could see coming her from the door of her car walking towards the yoga studio. Um, she was supposed to be destined to never walk again. And yeah, it happens. So it's not that you reverse the disease, but you can reverse the symptoms of it for sure. You can actually help, but no, I correct myself. You can actually decrease the symptoms of it to the point that it looks as if they don't have it.
Mm. Very cool. Yeah.
Yeah. So it does happen. And yeah, so another question. What complementary or integrative treatments are there for pancreatic cancer? Not sure you can give a treatment openly, but I wonder if you can say more specifically in which specific system or of knowledge has complementary treatments for this condition. I would answer this for general cancer. Again, cancer it's very interesting. This is how I even tell my students when I give this class. When you have a problem in your immune system, you either have cancer or not immune disease. Okay. It's one way or the other. Okay. In both ways, you are kind of attacking yourself, right? With different ways, but you are attacking yourself. Yoga actually helps to decrease this attack system. So when it comes to cancer, yoga is a tremendous, wonderful, and helpful tool. It doesn't matter which level of cancer, it doesn't matter which type of cancer. On the other hand, so far we've been talking about the benefits of yoga at the level of the health. So we're talking about medicine. But yoga was not designed to be a medical treatment. Okay, so all these things that we've been talking about are, let's say, the as our master so says, right? It's secondary effects. Okay, and Sadhguru says it's secondary effects of yoga, and that's how all the masters of yoga say. Like obviously you're gonna have some benefit at the level of the health, but it was not created for it. Yoga was designed so you can relieve your mental and body problems, so you can actually develop your spirituality. So the ultimate goal of yoga is to experience and develop a spirituality. And when I talk about spirituality, I'm not even talking about believing in something or, being devotional to something or somebody. I'm talking about that relationship that you have with, your neighbor, that relationship that you have with the people, that relationship that you have with the birds, that relationship that you have with the plants. Is that thing that makes you feel alive. It's that relationship that you have with yourself. And when you are sick and you have cancer, specifically, cancer and autoimmune disease are chronic conditions that are constantly reminding you that you are sick.
Mm. Yes.
So if you are doing yoga and eventually you relieve yourself from certain symptoms, you may be able to go and look through your mind and through your body and start experiencing life. So in that sense, we also recommend to do yoga in medicine because when you're sick, your spirituality it's needed. So that's why it's so important to do that. So I wouldn't say that for the question that this person did, I cannot talk about pancreatic cancer per se, and I will take advantage of this question to say something. We know that I've been since 2013, I've been helping to understand certain things to be able to answer to participants about what practices they can do or what they cannot do. So I've been collaborating on guiding the teachers on that. And sometimes I know that participants ask very specific questions. I normally say, please ask first your medical doctor what you can do, and then like that you can ask the teacher, right? So in case of, for example, pancreatic cancer, you can have different severity of it. And anyways, any practice of yoga that you're able to give to that person will benefit them. So that would be my answer.
You want to do one more question, Claudia, do you think? Or and wrap it up? Or
Okay,
is
let
there
me
others in the chat,
see.
or we can also end here too? What do you think,
Yeah,
Anne-Marie?
let me see if, yeah, I think we have some minutes yet. Uh,
There's two questions from Shanti Dukaram.
okay, so there is two questions more. What integrative medicine treatment available for TB?
PPPD.
Okay, for severe constipation, I guess.
No.
That's a very sorry. I wanted to take something. And then it says, I had a cancer, and I can say Hatha Yoga got me through the entire treatment strong without feeling me sick. Had double mastectomy and did not use any pain medication. I used pranayama. Thank you so much, Shanti, for sharing this. I think she's asking if there is something available for severe constipation. When we talk about integrative medicine, obviously we're not only talking about yoga, we're talking about other things. In general, the majority of the practice that we offer as yoga teachers will definitely help decrease the anxiety and help with the movement of bowel. So constipation gets, it decreases. But it's true that there are other kind of interventions at the level of integrative medicine, because in integrative medicine, we do not only give yoga, we also give, herbal medication and all that, all other different things. We can also use that. But in general, yoga would help. Normally, if I had somebody that comes with constipation, I probably will use a combination of food, uh, certain nutritional or herbal treatment, and yoga. So yoga for sure will go into the pot. So I don't know if
Yeah.
I don't know if anybody has any other questions. There is another one. Oh, somebody was asking with persistent postural perceptual dizziness, PPPD. Okay, well, I didn't see the question, but what was the question?
Can somebody having persistent postural perceptual dizziness
Yes.
do the practice through the Hatha Yoga?
That's a good question. If they can do Angamardana, it will depend on how severe it is, that disease. In this disease, the one that they're asking, or this condition, more than a disease, in this condition, the person tends to feel dizzy at the movement. So if they do not have that problem, because depending on the severity, they will feel dizzy all the time, or they will just feel dizzy with certain movements. Bending over can create symptoms. So what I would do is I would ask the person to which extent their condition does not allow them to do certain things. That's the question. And then we can follow up internally to see, depending on their severity, if they can join in.
Yeah. Well, thanks so much, Claudia. Yeah, just to maybe wrap up the session, I just wanted to again thank you. Thanks for Claudia to take the time. This doesn't have to be the end of the conversation as we do this wave. One of the things we wanted to do is highlight, various aspects of classical yoga, and this being a very important one. But we can definitely have Claudia back in different capacities and also hear from other teachers as well and other people who are practicing classical yoga. So this is a great start for us. And lastly, just wanted to point to the Wave website, hatayogawave.com. If you are interested in registering for the classes, you can find out all the information. You can follow us on Instagram, Hatha Yoga Wave. And it's been wonderful being with all of you. Claudia, if you want to say a last few words before we end, go ahead. You can say the final words and then we'll end the session.
Thank you. Well, basically, just invite everybody to come to this. If you haven't done any practice in the past of yoga, this is a great opportunity to start with something that will give you a cardio practice, a meditation practice, and something that will help you sleep better and become actually what we will be teaching that day. It's something that you will be able to use as a great tool to go through the day. The pranayama you will be able to do anywhere, anytime. So it's a great opportunity. It's very nice because another thing that happens is that we will be doing all together at the same time. So that creates, a certain movement. And we're very, very happy. Thank you so much for inviting me. I will be more than happy to assist everybody. Anyways, we already are saying we are all a team. So make sure that if you are coming to the session, everybody will be connected, and obviously I will be connected. So if anything happens in class that we need some kind of a medical assistance, I will be there.
Yes.
So that helps also. And yeah, thank you very much. Thank you, Mahesh, because it was your initiative to do the Hatha Yoga Wave, and we are all just getting on board. And yeah, we will be happy to see you all. Let's make it happen.
Thank you all for joining. We'll be in touch, and please continue to engage with all of us on the Hatha Yoga Wave. Thanks, Claudia.
Thank you. You take care.